Today, I would like to discuss a topic of hypospadias in children. What does this mean? This simply means that there are some children who are born with the urinary opening not at the tip of the penis but on the body or on the shaft of the penis. This also results sometimes in curvature of the penis. Hypospadias repair, or the field and science of hypospadiology itself, is rapidly developing over the last 30 years. It has been well understood that hypospadias surgeries are one of the most difficult reconstructive surgeries that is possible in the human body. Generally, these children are operated anywhere between 6 months to 2 years of age. Some of them require 2 to 3 stages, each stage of surgery spaced 6 months apart. The goal of hypospadias surgery is threefold. First is that the penis should not have any curvature, and the curvature which most of these kids with hypospadias have requires to be corrected. Secondly, the penis should have adequate functional length, because most of these children who are born with hypospadias have a curved penis and therefore the length is much shorter. And the third is that the opening through which they pass urine should be all the way at the summit or at the tip of the penis and not anywhere in the shaft. So over a single stage or 2 stages of surgeries, all these 3 goals are achieved. Hypospadiology itself and the surgery is difficult, requires a great skill set, a wonderful team of anesthesiologists and operation theatre staff, along with a good counseling team where the parents are explained everything about this condition, how long will this take, and the number of stages that it may require. Even in the world's best centers, the results range between 70 to 80%, with 20% of the children requiring a reoperation the second or third time. Nuhospitals has been performing hypospadias surgeries over the last 25 years. We are also a referral center for this particular condition, and parents bring their children from far and wide, even from abroad, to get these surgeries done.